Imagine your city's plumbing system suddenly deciding to go on strike. Total chaos, right? Well, your body has its own elaborate drainage system, and when it gets blocked, things get incredibly messy. Welcome back to A Scientific Life. I'm your resident health expert, and today we're diving deep into the dark, twisty, and sometimes explosive world of your gut. Let's talk about bowel obstruction. It might start off feeling like ordinary constipation, just a stubborn refusal to let things go. But don't be fooled. This isn't just a lazy digestive tract. It's a full-blown biological crisis. If left untreated, this traffic jam in your belly can lead to severe complications, serious illnesses, and yes, even the ultimate game over. Today, we're unpacking the mechanics of this internal disaster. We'll explore the unexpected causes, the glaring warning signs, and how to react before your intestines decide to stage a violent revolution. Consider this your ultimate survival guide to gut health. First, let's get acquainted with the hiking route your food takes. It's not a straight shot. It's more like a scenic, winding mountain road. The human intestines are incredibly long, beautifully coiled, packed tightly inside your abdominal cavity. This fleshy hose functions in a highly orderly manner. It diligently digests your meals, absorbs all those precious nutrients, and politely escorts the waste out. It's a beautifully orchestrated conveyor belt. But what happens when this conveyor belt hits a massive roadblock? Whether it's a barricade from within or pressure from the outside, the system crashes. Liquids, gases, and food waste suddenly have nowhere to go. Impaired movement leads to an immense buildup of pressure inside your abdominal cavity. It's like shaking a soda bottle and refusing to open the cap. When a blockage occurs, your body doesn't just give up. Oh no, it fights back. It violently tries to squeeze the obstruction out, leading to some of the most intense, crampy pain you can imagine. To forcefully push out whatever is stuck, your intestinal muscles go into overdrive. It's like trying to squeeze a bowling ball through a garden hose. Spoiler alert, the garden hose is not going to win. This heroic but painful effort is why patients experience intermittent, severe cramping. Your body is essentially doing aggressive reps at the gym, but the weights are made of trapped gas and digesting food. Above the point of the blockage, the intestines become engorged. The blockage grows larger as it fills with wind, liquid, and yesterday's lunch, while the lower part of the intestine sits completely empty. It takes time for the blocked section to collapse or give way, because there's nowhere for the pressure to escape. This terrifying state of inflation has a direct and devastating impact on the intestinal wall. If the pressure gets too high, it can lead to severe bleeding or even a blowout. But what actually causes these catastrophic roadblocks? Let's look at the usual suspects, starting with the most common one. In adults, the leading cause of this internal traffic jam is abdominal adhesions. Think of adhesions as your body's over-enthusiastic attempt at using duct tape to fix a leak. They are essentially bands of scar tissue. This often occurs after you've had some sort of abdominal surgery. Your body creates connective tissue to repair the surgical damage. It has good intentions, really. It just wants to heal you up nicely. But sometimes it gets carried away. That helpful scar tissue turns into a tough, fibrous rope that accidentally constricts or pulls on the intestines. It's like a rogue vine strangling a tree branch. This creates a sharp bend or a stricture that completely blocks the passageway. Years of accumulation and minor scarring can lead to major problems. And the worst part? It hides perfectly until it strikes. You hardly know this fibrous trap is lurking in your abdomen until the symptoms hit you like a freight train. One minute you're enjoying a burrito, the next you're curled up in the fetal position. Another very common cause is a hernia. Imagine your abdominal wall as a sturdy fence. When that fence gets weak, a little loop of intestine might just sneak through a gap, like a dog escaping the yard. Some of these intestinal loops may escape and get stuck in those holes or gaps. If the protruding intestine gets pinched tightly by the surrounding muscle, we have a serious hostage situation on our hands. When blood flow to that trapped area is interrupted, we call this condition an incarcerated or strangulated hernia. It sounds like a medieval torture device, and honestly, it pretty much feels like one too. This is an absolute medical emergency requiring immediate surgery. Without fresh blood, that trapped piece of intestine could literally die within just a few hours. The pain is usually very sudden and incredibly severe. Moving on to another culprit, especially among the older population, colon cancer. This is a major cause of blockages in the large intestine. It's essentially a very unwelcome roadblock, slowly building itself. A tumor that is slowly growing inside the intestinal wall acts like a narrowing tunnel. As the tumor gets bigger, the passageway for your digested food gets smaller and smaller, making travel very difficult. Initially, patients might only experience some difficulty doing their business, or they might notice their stools becoming smaller, resembling little pencils, as they squeeze past the growing tumor. Eventually, if left unchecked, the tumor will block the entire airway, or rather, the poopway. This results in a complete bowel obstruction. The traffic is stopped entirely, and the alarms start blaring. This is precisely why colorectal cancer screening is so incredibly important. Catching that rogue speed bump before it becomes a massive, impenetrable wall is crucial in preventing this painful crisis. Don't skip your screenings, folks. Your future self and your intestines will thank you profusely. Now, let's talk about a condition that sounds like a bizarre dance move: intestinal torsion, or volvulus. Normally, your intestines are free to wiggle and jiggle a bit. But in a volvulus, the intestines literally twist and rotate around themselves. It's exactly like wringing out a wet towel to get the water out. Except, in this case, the wringing action immediately cuts off the blood vessels supplying the intestines. It is most commonly found in the lower part of the large intestine, and it is an absolute disaster. Symptoms of this twisted catastrophe develop incredibly quickly. In severe cases, patients will experience massive bloating. Their abdomen might look like they swallowed a fully inflated basketball. The pain is severe, unbearable, and relentless. It is a life-threatening condition if not treated with a prompt solution. Untwisting that biological towel requires urgent medical intervention before the tissue dies. Now, let's talk about the kids. In young children, the most common cause of a blockage is something called intussusception. It's a big word for a very bizarre phenomenon where the intestine eats itself. Well, not literally. It's a condition where the upper part of the intestine folds or telescopes inward into the lower part. Imagine collapsing a vintage pirate telescope or folding up a collapsible drinking cup. This telescoping action causes severe blockages, massive swelling, and intense inflammation. The poor child will experience intermittent crying, pulling their knees to their chest, alternating with periods of weird calm. They might become lethargic and, most alarmingly, pass stools that look exactly like red currant jelly. Yes, bloody jelly-like stools. It's a terrifying sight for any parent changing a diaper. These jelly-like stools are a massive, flashing danger sign. If you see this, you need to rush the child to the hospital immediately. Time is of the essence to unfold that trapped little intestine. In addition to these physical, structural problems, there are also functional blockages. This is a blockage caused by bowel failure, also known as a paralytic ileus. The pipes are clear, but the pump is broken! A paralytic ileus often occurs after abdominal surgery, a severe infection, or even from using certain medications. The intestines just say, "Nope, we are on strike today," and completely stop moving. Some types of strong pain relievers, especially opioids, can cause this. The intestinal muscles temporarily forget how to contract. This causes undigested food and gas to just sit there, leading to epic bloating. While this might not always require immediate surgery like a physical blockage, it still needs to be closely monitored. Doctors have to coax the lazy intestines back to work to prevent further complications. So, how do you know if your bellyache is just bad takeout or a full-blown obstruction? Let's look at the 4 main warning signs of a bowel obstruction. Pay attention. This could literally save your life. The first symptom is pain, but not just any pain. We're talking severe, intermittent abdominal cramps. It comes in waves, matching the rhythm of your intestines, desperately trying to push against the barricade. The second symptom is vomiting. And here's the gross part. If the obstruction is high up, you'll vomit normal stomach contents. But if it's lower down, well, the backup has to go somewhere, right? The third symptom, which occurs quickly and is very noticeable, is severe bloating. Your belly will distend, feeling tight and hard like a drum. You might even look several months pregnant with a food baby. And the final, absolute red alert symptom is not having a bowel movement, and more importantly, not passing gas for an extended period. Absolute silence from the southern hemisphere is a very bad sign. If these four signals are flashing simultaneously, it indicates that your internal plumbing system is in a critical crisis. You are not just constipated. You have a barricade that needs professional demolition. Let's talk more about that pain. The pain from a bowel obstruction has a very specific characteristic. It comes in rhythmic waves. It's your body's peristalsis, the muscular contractions, fighting a losing battle. Your intestines squeeze hard, attempting to push out the obstruction, causing you to double over in agony. But then, as the bowels temporarily exhaust themselves and relax, the pain might actually subside a bit. You might think, oh, it's getting better. But wait a moment. If the nature of that pain suddenly changes, you are in deep trouble. If the cramping turns into a constant, sharp, and unrelenting ache, and if it increases with every tiny movement you make, that might be a terrifying sign. It means the intestines are beginning to perforate, or the surrounding lining is becoming severely inflamed. Now, back to the vomiting. Vomiting in the case of a low intestinal obstruction is not the same as common food poisoning. If the blockage is in the lower large intestine, things get incredibly foul. The vomit might have a greenish color from bile, but worse, it may have a strong odor and a color strikingly similar to feces. Yes, you heard that right. You are essentially throwing up poop. Science is beautiful. Because food residue remains trapped in the body for a long period, it ferments. Over time, the body panics and tries to expel the accumulated rotting substances through the only exit available, the top door. In every way, this condition will cause the body to rapidly deplete its resources. You lose water and essential electrolytes at an alarming rate. Meanwhile, the gases produced by gut bacteria continue to multiply. Since this gas cannot be expelled downwards, it accumulates inside the intestines. The intestines stretch, causing the abdomen to expand more and more until the skin is incredibly taut and tense. If a doctor taps on your swollen belly, a hollow, crackling sound can be heard. The sound is clear and resonant, exactly like the sound of a tightly tuned pressure drum. You become a human percussion instrument. This massive increase in abdominal volume will physically compress your diaphragm. The patient begins to experience significant difficulty breathing and feels an immense, crushing discomfort in their chest. If left completely untreated, this terrifying ballooning effect can cause the intestinal wall to stretch so thin that it actually ruptures. This is the absolute worst-case scenario we want to avoid at all costs. One of the first questions doctors will frantically ask you in the ER is, have you passed any gas recently? They aren't being rude. They are checking for absolute blockage. No farts means a totally blocked pipe. Absolutely no gas traveling through is a massive red flag. Many people mistakenly believe it's just a bad stomachache from eating spicy food. They try to tough it out or take an antacid. Big mistake. If you have severe pain, vomiting, and you absolutely cannot fart, this is not typical constipation. This is a blaring red alert signal from your body. You need to get to an emergency room as soon as possible. The most frightening complication of all is intestinal rupture. When the intestines expand excessively, the incredible pressure inside will start to physically compress the tiny blood vessels in the intestinal wall. These small blood vessels are supposed to supply oxygen and nutrients. When the intestinal wall is starved of blood, the tissue begins to suffocate. The intestinal lining rapidly begins to die off. We call this ischemia, and the dead parts of the intestine literally turn black and begin to rot inside your body. It decays rapidly, releasing a massive wave of deadly toxins and aggressive gut bacteria. These toxins enter the bloodstream directly, leading to systemic shock, organ failure, and a complete bodily collapse. It's a cascading disaster that starts from a simple, blocked tube and ends in the ICU. If the swollen, necrotic intestines finally burst, it's a catastrophe. A massive amount of toxic food waste, digestive juices, and billions of bacteria will flood directly into your sterile abdominal cavity. This causes an immediate and lethal infection called peritonitis. Inflammation of the peritoneum occurs instantly. In severe cases, patients will spike a dangerously high fever and develop a totally rigid abdomen. The abdominal muscles lock up to protect the inflamed organs. Your belly becomes stiff like a wooden board, and the pain is unimaginably severe throughout the entire area. The situation is now extremely critical. Emergency surgery is required not within days, but within minutes or hours. Surgeons have to rush in, flush the entire abdominal cavity to clean out the toxic spill, and surgically remove the dead portion of the intestine. But let's rewind. Upon your arrival at the hospital, before things explode, doctors will begin with a thorough examination. They will whip out their trusty stethoscopes to listen to the sounds of your belly. Listening to bowel sounds is an important first step. Normally, it sounds like a quiet, gurgling brook. But with an early obstruction, they might hear the intestines contracting very loudly and frantically. It sounds unusually frequent and high-pitched, like the sound of rushing water through a narrow pipe. However, if the blockage has lasted so long that the intestines have become completely exhausted, there will be dead silence. The doctor will also press on your abdomen to check for stiffness, rebound tenderness, and the exact location of the pain. The ultimate goal is to quickly assess the severity and pinpoint the roadblock. Next up, imaging. Abdominal X-rays in both standing and lying positions are basic but vital tools. During a diagnosis, the doctor will look for a classic sign called the air fluid level on the X-ray. It literally resembles a water level in a half-empty bottle. The liquid and the gas in the intestines separate and are arranged in a distinct layered pattern because they can't move forward. It's a dead giveaway. In addition to X-rays, a CT scan is the ultimate detective tool. A CT scan provides a much clearer 3D picture of the exact blockage location. It answers the crucial questions. Where is it? And what is it? Is it a tumor? Is it a twist? Is it a hernia? A CT scan helps the surgical team plan their attack. It provides precise information for precise treatment. Because when it comes to your gut, guessing is not an option. The very first step in treatment is usually to decompress the system and lower the immense pressure. Brace yourself, because the doctor will likely insert a nasogastric or NG tube. It's not fun, but it's necessary. This lovely plastic tube goes up your nose, down your throat, and all the way into your stomach. Its job is to act like a vacuum cleaner, aggressively sucking out the trapped gas, liquid, and digestive juices. Removing the remaining liquid in this way will rapidly help reduce the immense pressure. It immediately relieves the painful abdominal bloating and stops the horrific vomiting. It's uncomfortable, but it brings massive relief. You'll also be hooked up to IV lines. Intravenous saline and electrolytes are pumped in to rehydrate you and support your failing bodily functions, alongside some heavy-duty painkillers to make life bearable again. This initial step gets your body stabilized and ready for whatever comes next. Sometimes, just resting the bowel with the NG tube and IV fluids is enough. The intestines might relax, and the blockage might resolve on its own. We call this drip and suck management. It's a matter of waiting for the bowel to figure its own mess out. But unfortunately, not every patient gets off this easily. Surgery is absolutely necessary in many cases. If the blockage is caused by tough fibrous scar tissue, a tumor, or a strangulated hernia, waiting won't help. If symptoms do not improve after 24 to 48 hours, or if there are signs of dead tissue, it's scalpel time. Surgery becomes the only option to save your life and address the root cause of the obstruction permanently. The surgical team aims to go in and fix the plumbing directly. It's high-stakes biological engineering. If it's a blockage caused by scar tissue, the surgeon will carefully cut and separate the fibrous bands, freeing the trapped intestine. If it is a tumor, the procedure is much more extensive and complex. They would have to surgically remove the entire portion of the intestine containing the tumor, along with surrounding lymph nodes. Then, they take the two healthy ends and stitch them back together to restore the flow. However, if a large part of the intestine is already dead and necrotic, it has to be completely removed. In some severe cases, it's not safe to reconnect the ends immediately due to massive infection or swelling. In those situations, the surgeon may need to create a temporary colostomy or ileostomy on your abdomen. This means your waste will temporarily exit into a bag attached to your stomach, allowing the insides to heal. Don't panic. In many cases, we can reconnect it later once the inflammation has completely subsided. But regardless of the method, abdominal surgery and the subsequent recovery take time and are physically challenging. Post-surgery, the waiting game begins again. The medical team has to wait for the traumatized bowels to wake up and start moving. The patient must start incredibly slowly, just taking tiny sips of clear water. From drinking water to eventually eating regular solid food is a gradual process. your doctor will strongly emphasize getting out of bed and walking as soon as humanly possible, even if it hurts. Walking is magical. It mechanically stimulates bowel contractions, wakes up your digestive system, and crucially, helps prevent new scar tissue from forming in the future. Movement is medicine for your gut. Once you're healed, how can we reduce the risk of this nightmare happening again? First, eat a high-fiber diet. Fiber is the broom that sweeps your intestines clean. And drink plenty of water to keep things moving smoothly. Stay hydrated, exercise regularly, and chew your food properly. For those who have had previous abdominal surgery, pay special attention to your digestion. Avoid swallowing huge chunks of difficult-to-digest foods. Bowel obstruction might sound like a terrifying horror movie, but knowledge and self-observation are your greatest shields. Never ignore severe, rhythmic abdominal pain, especially if the gas stops flowing. Speed is the absolute key to surviving this crisis. Remember, every single minute counts when your plumbing is blocked. Stay mindful, listen to your gut, and here's to everyone having a happy, healthy, and unblocked digestive system.